Hello, Debbie Nelson with Alternative to Meds podcast, and I am so excited to introduce Dr. Julia Britz.
Hi.
Hi, Julia.
Hello. I'm so excited.
So I've been this huge fan of you from your blog that you do, from your TED Talk, and now you have this amazing story, and now you're joining our team, which is amazing, just because your story is going to lend itself to be such an incredible healer. So it's not about me. I want to give you the podium. I want you to kind of introduce and say what your story is and what inspired you to become a doctor.
Oh, thanks, Debbie. I know it's so crazy to think that it's all gone such full circle now, but yeah, so I guess for me, it started when I myself had really severe OCD, and, Ativan was a big part of my life. And so that's the thing, like, I guess we all kind of deal with ways we want to cope with our issues. So that's how I coped with mine. I was very scared to go to therapy. I tried, but I did my best to see if I could keep myself safe in my little bubble. And eventually my OCD did get so bad that I did need to get outside help, and I couldn't manage it myself anymore. And that's when I started getting naturopathic medicine, and that worked really well for me in conjunction with therapy. And as I was doing that, I started my blog, which was so important because at the time there was nothing online besides mayoclinic.com and Wikipedia and that kind of stuff. And I needed to know exactly what it looked like, because that's sort of the thing that I think I did was to cope with also things. I wanted to dive in and research my own mental illness. To me, that was how I could kind of make myself feel better about what was going on and have some sort of control. But in doing so, I learned there wasn't much out there. So I started my blog and my video channel, which is really important because I wanted people to see that a very normal person could have a mental illness and it wasn't anything to be ashamed of. So in doing that, it sort of helped me let go of some of my own shame. And it kept going. I met a lot of people through that. It was awesome, and I still keep it going. And eventually I got so much better. So I decided to go to naturopathic medical school because I felt like if I was lucky enough to get as well as I did, then I couldn't just stop there. I really wanted other people to get better. I was told that people as severe as me couldn't get better. So if I was one of the lucky ones, to me, that just said I had a lot more work to do and help people get to the other side to where I got.
How is it? What is the functional medicine piece? What does that do? How does it help people?
Oh, yeah. So I practice I guess to begin, I've really separated it out from germ theory and terrain theory. So I practice more of what's called terrain theory, meaning that for example, if somebody's got strep throat and you line up 10 people with strep throat, everybody will get the same antibiotic and it'll work just fine. I found that idea of finding whatever the thing is and trying to treat it with one thing doesn't work with mental illness at all. So.
Did you not pause? We were having a problem there.
Okay.
Okay, go ahead. Pick it up.
So I found that it's not as effective as using what is called terrain theory, which is what's happening in the person's body that makes their own internal environment conducive to expressing a mental illness. And so instead of trying to treat the mental illness, treat the person and find out how do we rebuild that person's anatomy and environment so that they can better handle whatever mental stress is going on, increase their psychological flexibility. And that requires a lot of functional medicine, meaning for me, targeted amino acid therapies is huge.
Right.
I'm really big into mineral testing and also blood analysis. Oat testing is really important. Nutrient analysis is really important. I also like bioresonance, which is really cool. And I've lately started really practicing peptide therapy, and I've had a lot of success with that. So there's all kinds of ways to basically take what the body already has and just sort of modulate it, put it back into balance so the body doesn't react with OCD or react with schizophrenia or react with depression. It's just bringing it back to balance, and then the body shouldn't have such a expressive need to come out with these negative symptoms.
That's it. I mean, for me, I manage my own things and traits, and I recognize, like people will say all the time, as I'm educating them on what alternative to meds does, it makes such perfect sense. And it's surprising how this movement is growing larger and larger. I mean, conferences and the awareness and the internet has just brought this to a greater awareness that when someone gets on our doorstep, oftentimes they've gone a traditional route. They've had a doctor prescribe them multiple things and they haven't gotten well. But I always say, well, did any of these other root issues get addressed? It's kind of like saying antibiotics are bad. Antibiotics aren't bad, they have their place, but when the overuse of them, they no longer are effective, and then it causes horrible problems for everything else within your body.
Right.
And mental, that's what we always say. It's like an integrative approach doesn't say that medication is necessarily bad. It has its place for stabilization. But if we never get to the root issues, like if we never deal with that, and so that is so refreshing to most people. And when they hear someone like yourself, they didn't realize that there's this that exists.
Oh yeah.
So someone that's like looking at, well, wait a minute, what do you mean? Why would this? How many people I've talked to, they had no clue, like their diet would so significantly impact their mental health. I'm doing a vlog on beauty products and learning about, using clean beauty products and how all the carcinogens from beauty products affect our hormone system, and our hormone system gets affected, our mental health. Yeah. And so all of these factors that are around us all the time, but it's so amazing to have you join the team. I mean, with Dr. Lee, so we've got the psychiatrist, we have the naturopath that works closely working with therapists. And I always say it's this wonderful think tank, and you joining is like this amazing member because of your background. It's not saying that people can't, but I feel like some of the best healers is because they speak from a very personal point of view.
Oh, sure. I mean, I think there's so many reasons to get into healthcare, and so many wonderful reasons to do that. And for me, I do honestly feel like I relate more to people because I've been there and because I get it, and I remember not having a lot of patience with myself, like really struggling in therapy, struggling to stick to certain treatment protocols and getting really frustrated. And because I remember what that's like, I can extend a lot more patience to my patients, if that makes sense, and a lot more compassion because I was there and I get it. Right. And that's the thing. It takes for some people, it's going to take a really long time. For some people, it doesn't take that long. Like for me, right. When everything got on track, it was virtually a month before I was, it was really, really amazing because I responded very well to certain things. Also just genetically, my detoxification pathways respond pretty much classically, like textbook.
Good.
I know, which is very fortunate, but yeah.
But that's not everyone. I mean, sometimes I always say it's a journey. Like, I don't know at what point. I remember all of a sudden one day going, oh, wait, this is the way normal people sleep.
Right.
I'm like, wait, people like go to bed and they sleep and they wake up. Yeah. And it was the first time recognizing I didn't need sleep medicine. I needed the right diet and the right nutrients to build serotonin in my body so that I could have natural sleep cycles. Yeah. And when all of that's in, then all of a sudden you wake up in the morning, you're like, wow, this feels like normal people.
I know.
I used to look at other people and they'd say, just marvel at them. And it's not saying I don't ever have periods where it slides back down. And that's what I tell our bodies are normal. I mean, we have stressors in life and whatever else.
Right.
So it doesn't throw me right back into that mentality of going, oh, I haven't had sleep. Oh my gosh. Instead, I'm like, yeah, okay, I can get this synced back. The difference is I have the tools to do it. I know what amino acids benefit me, and I know what diet does for me. And, I look at all those different things. But I'm just this piece of mental health is so overlooked, and
Yeah.
so that's the piece that's so wonderful and beautiful to have it in conjunction with everyone else, because like you said, you've had therapy, so it's not just, you know, one thing.
Oh, absolutely. You know, I think I've tried virtually everything except for SSRIs. That's the only thing I didn't do.
Mm,
Which is really funny because they really could have helped me, I suppose, but I was so afraid of the side effects, so I just didn't do it.
right.
Um, and that's the thing. It's everybody's going to respond their own way to certain kinds of treatment, and that can even change over time. So it's really not uncommon for someone to tell me, oh, this was working really great, my sleep was awesome, my anxiety was gone, but now it's not working anymore. And that's such a common thing, and it has everything to do with the fact that when certain nutrients in the body start to level out and get even, then whatever that was, I guess, complementing or pushing something into place to compensate for that will become out of balance next. And then it's a case of like, okay, well, now that we've calmed this down, how do we calm the next thing down? How do we calm the
That
next
is
thing
not
down?
fair.
I know, it's not
It's
fair.
not fair, but that's true. It's so true what you're saying. It's like you'll calm one thing down and it seems to be dialed in, and but we also are in very toxic environments nowadays.
Yeah.
I mean, nobody takes into account, and it was not until I worked with alternative meds, so I got trained in amino acids and had my diet dialed in, and it was all of a sudden like it never occurred to me when someone's like, well, what do you clean with? I'm like, oh, I like smells. I like smelly things. I'm
Yeah.
the one that was always, you know, snuggle. Everything has to smell. I had candles burning always in my home. I like perfume. I'm the most toxic. So when I'm saying this, see, to someone like you, you're going, naturopaths looking at me like mortified, because, and now when I talk to other people, it's like a light bulb, you know, like I said, now beauty products and all of these other things, you start looking at it in a whole different light going,
Yeah.
yeah, makes sense.
I
Makes
know.
sense.
And you know what, Debbie? When I get there, I'm going to show you how to make really healthy, safe, non-toxic candles. And you're
Okay, you can do that. I've nailed down. I make body butters.
going,
There's times I make it with all the clients, all of our residents that are there. I take out the shea butter, and now I'm so hooked to making it. It's so easy, and it makes me realize, God, look at how much money. It's all organic, and it
yeah.
smells great. And I'm like, God, this is so easy, and I know what I'm putting on my body, and I
Mm-hmm.
don't have to worry about what it's doing to, you know. And before, I'm not kidding. I mean, I was the Victoria's Secrets. I had every perfume,
Right.
I had all the lotions, and so someone like you know, when I'm talking to them, they're like, you know, so there's that's the piece, and that's why it's wonderful introducing you to the team, but talking about it just because our therapist is every bit as important as this piece, as every bit as Dr. Lee, because it's kind of like a puzzle. I always tell everyone that someone
Yeah.
shaped it up, and I said everyone's puzzle is different.
Oh, yeah. It absolutely is. And I think, you know, there's the biological stuff and the psychological stuff, you
Right.
know, and I can help with the biological stuff, and I can take someone as far as we can go.
Right.
The psychological stuff, though, it does have to happen. And
Right.
that's where Dr. Lee is going to be like absolutely essential, because when it's
Right.
done together, it's so awesome. And I
It
do
is.
find for a lot of people, the emotional component is the one where people are like, I don't want to do that. I'm not
Yeah.
talking about my parents. It's not going to happen.
Yeah.
Forgiveness. Nope. You know, but it's like, and everyone's got their own journey through that.
Right.
It does tend to be the last thing to go. But when it does, it's like a door just opens and it can just be a game changer.
So, welcome.
Ah, thanks, Debbie.
I think when I get emotional, just because when you joined, I was like, we have this amazing team of individuals. We really do. And you're an abs.
Aw.
And knowing that you'd be able to reach them in a different way, that, you know, a lot of people, and it's not saying others don't, but I know for me, when I speak to someone else that can identify with me, I mean, I battled my weight my entire life. So if I was to go to a trainer who's never had a problem with their weight, I tend to kind of go, oh, that's really nice, but you really don't understand what I'm talking about here.
Right. Yeah.
So when people actually share and are willing to be very transparent as doctors, and a lot of doctors aren't, but when they are transparent, it just opens up everyone to go, you too? You know, you had this? Well, wait a minute, you got better? You know, because I'll say people do get better. They can.
And it's so nuts. I love that you said that, because I feel like I still need to say that to myself sometimes, you know, like, because sometimes, you know, we've all been there, that you feel so alone and you're suffering by yourself, and, you know, you just think no one can help me, or like, I'm not going to get better, you know? And so I say that to everybody. Every session I have with a person, I say that every single time, because it needs to be a reminder, you know, because we forget and we have doubt, and sometimes we're like, well, we don't get as far as we want to get to, or we expected something to work and it didn't. And, you know, it's going to happen. It will happen. It's just how it happens.
Sometimes I always say, sometimes the more intellectual a person is, the worse it is.
Yes. Oh my God, 100%.
Yes. Intellectually, you keep thinking, I should be able to handle this.
Yeah.
And I certainly don't want to let the world know this is what's going on.
Yeah.
You know, I should be able to handle this. Like, I got to figure this out. I mean, other people, you know, and it's when we start, just like I said, when you open that up and you say, then all of a sudden the world, everyone is affected in some shape or form, in their family, in their, you know, and the stigmatism of getting the help or admitting it is diminishing with time. You notice that there's a lot more, whether it's a celebrity. What I love, though, is that with this movement of functional medicine, with naturopathic, combining and integrative approaches, it's giving people tools that they never had before.
Exactly.
I mean, nobody had these tools before until I had aminos. When I've never been trained in that. So when I got introduced to that, it was like a whole world. But no one taught me about how I could balance my brain using nutrition and nutraceuticals, which is just therapeutic doses of nutrients, you know?
Yeah. Mm-hmm.
So I love everything that you do. I'm so happy that you're here and coming to Sedona and joining the team at Alternative to Meds. Welcome.
Thank you, Debbie. I'm so excited. It's going to be awesome.
Super excited.